Yes, I salute everyone who is watching this short clip from wherever you are. It's good afternoon right here, and live here we are streaming from Pakta Rehabilitation Center in Ikulu. But then I just wanted to re-echo something very small about addiction. And to begin with, we really have to know what addiction is. It's actually progressive chronic illness that start from different aspect in life. So before somebody getting into addiction, what might have predisposed somebody to become addicted? And we have different forms of addiction: addiction to food, addiction to alcohol, addiction to drug, addiction to sex, addiction to all kinds of lifestyles. But then here we are zeroing down to addiction of alcohol, addiction to alcohol and addiction to drugs. And so when we're talking about addiction to drugs, it is actually so complex in a way that even all the prescription drugs that we take for different purposes, for diagnosis of different conditions, for treatment of different kinds of illnesses, some of these prescription drugs, also when we misuse them, at times we can also develop addiction, especially if they are not controlled. And so you get to realize that sometimes we are taking these drugs, but because of the euphoric effect, we now have to adapt tendency of self-medication. Sometimes you're overdosing yourself, then you end up getting addicted. But now our major focus is talking about addiction to alcohol and addiction to drugs. So these drugs can be the prescribed drugs or drugs of misuse in the name of marijuana, cocaine, dihydrococaine, jet fuel, petrol, and different kinds of other drugs that are taken through maybe Antero Road. Like Kube, we also have some called Kube. We have other forms of local tobacco where people crush them and they sniff them into their through their nostrils. So now, before somebody getting addicted, that means there has been an history about misuse of either alcohol or drugs of abuse in question. So the thing is about how do people get involved, or how do people get in the first encounter with alcohol. So you get to know that there are very many reasons as to why people get into the life of alcohol. First and foremost, in many encounters, you find that there's issue of peer pressure. People want to get involved because when you get so high, and of course these drugs makes people get so high, and maybe when we get time we shall talk about that. It's because of peer influence. I want to drink, I want to be like so and so. When I grow up, I want to be like you, because somebody is trying to admire the way you behave, the way you do when you are under what influence of these different kinds of drugs, of abuse, and of alcohol. And then another thing, as stressing factors, people get involved into these drugs and alcohol has a way of compensatory mechanism, because they are stressed. Some of them are too depressed that they can't do their daily life without these things. So they have to find a way of covering themselves up. Then another thing could be a side effect of some of these prescribed drugs, because you have been using it for quite some time. So apart from the intended purpose, there are other things to do with the euphoric effect. There's a way that when you use the drug, somehow you get so excited, you feeling so comfortable. As a case in point, these narcotics which are used in treatment of severe pain. So after clearing the pain, there's a way how somebody feels so happy and comfortable. Now, these are some of the reasons as to why people are driven into self-medication. Then afterward, boom, it becomes an addiction. Now, what do we have to know about addiction? Addiction, just like I introduced from the beginning, it's a process. Okay, you don't get addicted 1 or 2 days. But then what happens? Once you start misusing the drug or alcohol, somehow the body is going to get used to, and you develop what we call tolerance. And now after tolerance, the concentration becomes so high in your blood every time and then. Now your body has gotten used. Okay? But now you don't care about the dangers associated, the dissatisfaction. Remember, we said once you consume 1 or 2 amount of a commodity, it becomes a dissatisfaction, because there is that functional part of it has been there, then you have accumulated more, which is no longer what? Of use in the body. No, slowly by slowly, you continue taking for the after effect. You continue taking like that, so your body will now develop the concentration within the blood, and you can't do without. It starts controlling your body system. It destabilizes you until you develop what we call withdrawal syndrome. The moment they stop you from using it, you get the withdrawal syndrome, and now you can't do without. When you stay for some hours without that, there's a way how your body responds. Maybe headache, falls, abdominal pain, or some other things. Then you start hoping to get more dosage so that